Do facial fillers cause cancer? And if so, what do you do if you've already had fillers? And if you're thinking about getting fillers, what does that mean for you? If you're thinking about getting fillers, if you've had fillers put in, if you are concerned about facial fillers and the possibility of getting cancers from it, you are going to love what I got to say. But first, welcome to Go Beyond. I am Professor Zed. Go Beyond is about you going beyond. It's about you reaching your peak potential. P to the third power. Peace, purpose, and prosperity. It's about becoming part of that 1% of people who strives to reach their peak potential. Body, brain, mind, and spirit. Let's get to work. In this video, we are going to talk about fillers, dermal fillers, what they are, what are the side effects, and whether or not you should be concerned about them causing cancer. First, let's talk about fillers and what they are. Fillers, as the name suggests, are things that you inject to fill an empty space. That's the simplest way of putting it. There are many different types of fillers. The most popular type is hyaluronic acid. Hyaluronic acid is something that your body already makes, but that gets depleted over time. You have other types also that may be used. Some fillers last as little as 6 months, while others may last up to a year, and others less than 2 years. There is actually one filler that is a permanent filler. All fillers are not created equal. Some fillers may be used for volumizing, while others are used for wrinkle reduction, stimulate the body to rejuvenate itself. What are fillers used for? Fillers are used to replace or to correct volume loss. What is volume loss? Volume loss is fat loss in certain areas of the body, the face, the buttocks, maybe in certain other areas as well. Back of the hands and things like that. Volume loss may be caused by weight loss, sickness, diseases, aging, also by treatment of certain diseases such as cancer and HIV. Fillers are used to replenish volume where you experience volume loss. Besides volume loss, fillers may also be used to reduce lines, wrinkles, crepey skin, loose skin, and even cellulite. To be sure, fillers are not without side effects. There is nothing in medicine that comes without the possibility of some type of side effects. The most common types of side effects with filler treatments include pain, tenderness, and some swelling in the area. In my experience, those normally go away within 24 to 72 hours. If it lasts longer than that, you should contact your injector, as something more serious may be going on. With fillers, there are possible serious long-term complications. Although they are not very common, they do exist. Other less common side effects of filler injection may include redness and swelling in the area, indicating that you may have some type of infection that may need to be treated. Another possible side effect may be a raised bump under the skin. This is something we call a nodule or a granuloma that may need to be treated with antibiotics or injections. You may even need to get it surgically removed. Another possibility is necrosis. Necrosis is tissue death. Tissue death that may be the result of either the filler getting into a blood vessel, clogging the blood vessel, and now the tissues are not getting oxygen and they die. Another possible serious event that is reported in the medical literature is people going blind from filler injections, especially when they get injected in areas that could lead to that. Again, it all depends on the experience of your injector, the areas that you're getting injected, and whether or not you want to expose yourself to those possibilities. Also in the literature, there are certain case reports. Case reports are like the lowest level of medical information that you can get. It's kind of like an expert opinion. One of those cases was a woman who had a mass in her lung and they thought it was cancer. And after they spoke to her and questioned her, she reported that she had treatments with fillers done in her face and PDO threads and Botox 6 months before that. The clinicians who were treating that patient thought the mass in her lung could have been caused by the fillers that she got put in her face, but they did not offer any explanation on how it could have traveled from the face to the lungs. Another interesting case that came up was a woman who had a history of breast cancer, and she went to her doctor and they found a mass on her buccal area of the face. Basically right here, when they saw the mass, they thought it might have been cancer. Depending on the type of filler that was used, they may look like cancer when you do an x-ray, or they may not know what's going on and people may freak out, given her history of breast cancer. When they looked at it and they biopsied it and they questioned her further, she did admit that she had lip filler, and they felt that the lip filler may have migrated, causing the mass in her mouth. That's a possibility because fillers do migrate. Migration means that when you put them in one area, they move to another area adjacent to where you put them. Migration from the face to the lungs, that seems a little far-fetched. It is not impossible, but it does feel a little far-fetched. Now, one of the things that happens with fillers is that it does impact the lymphatic system or your immune system. Fillers are considered foreign body. So anything that you put into your body that does not belong in there will cause what is called an inflammatory response. Anything that tries to get into your body that does not belong there will cause an immune system response. And the same thing goes with fillers. The one thing with fillers, though, is that the way that it is made, the body does not 100% react to it all the time. It's not like you're getting a transplant and you have to take medication in order for you to keep the transplant in your body. The reason for that is because fillers mimic something that is already in your body called hyaluronic acid. You already have it in the skin, so it does not cause that much of a serious response with almost everyone, but it does cause a response. And the medical literature has shown that it does cause a response. Let's talk about cancer. Last week, a concerned colleague sent me a video about facial fillers and the possibility of them causing cancer. I looked at the video and I did not see at all where the case was made for fillers, facial fillers or otherwise, causing cancer. I watched the video, watched what it was saying, and I dug a little bit into the literature to come up with some answers, because I have been injecting fillers since about 2003. If there is the possibility of them causing cancer, I want to know about them. This is what I found out. Let's talk about that report that was done on that video. The video quoted a quote-unquote study that was done by a bunch of plastic surgeons and who showed that there was a possibility of dermal fillers or face fillers causing cancer. First, there was no reference to dermal fillers causing cancer. One of the things that they did mention in the video was that dermal fillers causes an inflammatory response in the body. This is a known fact. This has been in the literature forever. It is not anything new. It is no breaking news. It is not even newsworthy. This is something that we know. Now, we should pay attention to see how those long-term inflammation with the lymphatic system, what else it could cause. Anytime that you're causing blockage or an allergic reaction, you are at risk of developing all kinds of problems that we will not go into in this video. That was a valid point. What they did say is that they were going to study that effect and see what it could cause in the body, including the possibility of cancer. Let's wait and see what they come up with. One key thing that I want to mention here is the fact that the inflammation fillers cause is not essentially a bad thing. Clogging of the lymphatic system is a bad thing. The inflammation is not necessarily a bad thing. The reason for that is because most non-surgical treatments produces some type of inflammation. Many of the lasers that are used for skin rejuvenation, the whole reason why they work is because they cause some inflammation, forcing the body to repair itself. The inflammation is part of the process of rejuvenation, body repair. The lymphatics is where you have an issue. It is interesting that it was surgeons that were doing the study about the fillers because nothing causes more trauma to your body than surgery. Nothing destroys your lymphatic system like a tummy tuck or a liposuction does. And that's the reason why surgery should be reserved for people who have failed everything else. I am not against surgery. However, I am against unnecessary surgery. If it is possible for you to lose the weight and get in shape without surgery, I think you should do that. If you do decide that you're going to have surgery, you should know that you must commit to a lifetime of proper eating, exercising, and body treatments to move your lymphatics because of what the surgery will have done to your lymphatic system. That is fact. I must mention that I did find in the literature a report of a woman who had a lymphoma. She actually had dermal filler put in her face, but it is worth noting this woman did not have a regular dermal filler injected in her face. What she had injected in her face was silicone. To be sure, silicone is not approved as a dermal filler in the United States, and the report that I'm mentioning did not occur in the United States. The question is, do fillers cause cancer? Based on the current literature, no. It does not seem that fillers cause cancer. Could it possibly cause cancer? We don't know. It does seem that they cause an array of different problems. However, cancer is not one of them. Interestingly, fillers are also used for cancer survivors. After cancer treatment, many people end up looking in ways that they don't like, and oftentimes they seek aesthetic treatments. They are using fillers for patients who have had cancers in the past. The other question is, should you get fillers injected into your face or body? That is really up to you. Personally, I don't use the hyaluronic acid fillers. I use what they call a biostimulator. I use PLLA, which is a different type of filler. The reason why I choose that one is because it forces the body to repair itself. I use PLLA in combination with my own blood, PRP, to make that happen. The reason why I choose that is because I am saving the hyaluronic acid as a last resort should I need that in the future. It's not because I think anything is wrong with it. Next question is, if you did have fillers, should you get those fillers removed? That is a choice that you have. However, if you do get them removed, are you going to do maybe a fat transfer, go ahead and have surgery? Are you going to use PRP with PRF or PRP with something like Sculpture? Those are other options that you can use as well. Ultimately, the moral of the story is this. When you see things online, when you read things online, do not assume that the information that you're getting is correct. It does not matter who it's coming from. You should dig a little bit into it and get information for yourself before you start panicking. At the end of the day, the decision is still yours. You have a lot of the information that I just provided to you, and then you can read upon it yourself. Don't get scammed from people trying to sell you products. And what a better way to sell you a product than to scare you and say, hey, what you're using now is causing cancer, and maybe you should switch to this. I'm a natural guy myself. I do prefer natural treatments whenever possible. I just don't think it is ethically a good thing to bring up cancer to try to sell you something when cancer is such a serious disease that is causing so much pain and suffering for so many of us. I'm Professor Zed. Let's get to work.